coronavirus pandemic known as COVID-19 as declared by WHO as a public health emergency of international concern, a pandemic by all the statistical analysis as on date has created a devastation all over the world with an exponential increase in the number of people infected and the way it is spreading very fast, and the number of deaths has created a scare all over the world. It has drained the resources and the potential of each and every country almost that it has affected so far. It has tested even the superpowers and brought them down to the knees. As we all know, with the disastrous consequences of this pandemic on human life, economy, education, infrastructural developments all over the world, it has forced human life literally into hiding. Government of Jammu and Kashmir is also feeling the heat, as are the health workers in the front lines. We are trying our level best with the concerted efforts of one and all, with a series of measures, advisories, directions from the government, the administration, evolving guidelines, the treatment protocols, primarily with the directives from the WHO. We are trying to cope up to face these challenges and see to it that we try to contain the spread of this disease, minimize the sufferings, minimize the deaths as much as possible, and see to it that life comes back to normal as it has been before it started erupting in China in December 2019. People need to follow the advisories from the government, from the health professionals. Any person, irrespective of having a travel history or not, with features of flu-like disease on account of cough, fever, unexplained, or any symptoms of flu need to seek the medical attention, particularly those who have a history of travel to the highly infected areas, irrespective of the country or the region in a particular country. People who have been in contact with the patient who has been tested positive, or the health workers who have treated such patients. They must all seek the consultations of the medical facilities around, be in touch with the administrative nodal agencies who are in the forefront of managing this pandemic. People must observe home quarantine, administrative quarantine, or hospital quarantine as and when desired. That is the only way of trying to break the chain of the spread of this deadly viral disease. People must try to avoid crowded places, large gatherings on account of social or religious reasons. People must try to avoid going to markets. People must try to avoid all sorts of transactions in terms of cash, coins, sharing mobiles, the objects and articles of daily use, so as to limit the transmission of this disease. Those who have immune compromised status on account of cancer or chemotherapy or radiation therapy, chronic kidney disease, chronic liver disease, hypertension, diabetes, extremes of age, pregnancy, etc. These are the people who are vulnerable, wherein the risks are very high, who need to observe all the precautions as laid down time and again. Sher-e Kashmir Institute of Medical Sciences, a tertiary care center, a teaching institution, a research institution, is equally bearing the brunt. As on date, we have dedicated team of doctors, nursing officials, paramedics, engineers, security, sanitation services, and all other supportive manpower who have been put on three-tier system of duty for 10 days each on rotation basis as per the roster. We have dedicated COVID clinic to cater to the people who are suspects of this COVID-19 infection. We have a dedicated facility for isolation of the people who are tested positive. We have a dedicated facility for those people who are tested negative but have to be necessarily put in the hospital quarantine for a period of 14 days minimum. We have a team of engineers, doctors, and research scholars working simultaneously together to indigenize the equipment, the disposables, the consumable materials that need to be available for fighting this pandemic, giving the scarcity of the resources all over the world, be it ventilators, be it personal protection equipment, gowns, gloves, headgears, shoe covers, and so on and so forth. The markets all over the world are dry. The manufacturing plants have shut down. Most of the countries facing the wrath of this pandemic have gone into lockdown necessarily, and that has affected the production, shipment, and distribution of this supply chain. We are trying our level best to put our heads together and indigenize the necessities that are evolving for us for making our own disposable of oblique consumable items, even try to manufacture some respirators, respiratory assist devices, bare minimum equipment for ventilation purposes, and all other essential items by which we are dependent on the rest of the world. We have been having hour-to-hour debates, the audit, and trying to pool the resources to evolve strategies for fighting this war. We have dedicated 7 telephone lines For the people who cannot attend our OPDs because of various reasons, we have put our teams on different front lines in a very strategized manner so that a particular team is put off the duty for next 20 days and the next front line comes for next 10 days duty. We are trying to minimize the spread of this pandemic as much in the community level as much in the professional health workers who are on the front lines. I, as the head of the institution, with folded hands, request my fellow citizens to follow the advisories issued by the government, the awareness programs that the health professionals keep on putting in the press, electronic media, social websites, social sites for the benefit and guidance and awareness of the common masses. I would like to take this opportunity here that this coronavirus does not discriminate between haves and have-nots. It does not discriminate on the basis of color, caste, creed, status. Be it the Prime Minister of any superpower in the world, be it a man on the footpath, it strikes everybody. Before the human race is put even more distress, we need to put our heads together, not hands. We need to evolve strategies, cooperate with the government, follow the lockdowns, follow the strategies, understand the difficulties, understand the need of the hour, that if we stay home, we can stay safe, we can let others live as long as we live ourselves. My fellow citizens, I would like to reiterate that this enemy is a hidden enemy. We are fighting World War III. But as long as this hidden enemy continues to move ahead, we will have to be equally resistant, equally evolving strategies to eradicate it. And that is possible only if we break the chain of its spread, if we try to find out the vaccine to eradicate it, or if we are able to come up with new drugs, medicines to combat this war. It's a mission impossible as it appears today, the way the superpowers are crumbling. But this mission impossible can be converted into mission possible by joint efforts of one and all, especially the ones who are the advisors, who are the administrators, and who are the heads that matter in the wisdom or giving the guidelines from WHO down to any health institution like Sher-e Kashmir Institute of Medical Sciences. I request for coordination, for cooperation, for existing together. God bless us all.